Hey, Canna fam, what's up? It's Sticky Buds. Sticky Buds for CBD, aka Sticky Badine. Hope everybody's having a fine day. We got a little snow going on out here. It was supposed to be several inches, but it looks like we don't even have a half inch yet. But that's typical for the Midwest here. They call for a lot, and it doesn't usually follow through. But thought I'd share something with you guys this morning. Some of you know that I ended up in the hospital for a week unexpectedly, all because of something that was going to be very beneficial to me. I had a spinal cord stimulator implanted into my back along my spine in the epidural space, and it was going to be a huge pain management relief device and help me get off the opioids that I've been on for 3 years now and several other meds. But anyway, long story short, I ended up 5 weeks later back in the hospital because I had staph infection where the device was put in. So let me get started here on this new routine I got to do for 6 weeks, and I'll kind of narrate a little bit as I go through. But this right here, this is just a saline solution. This is a vaccine, not a vaccine, antibiotic, excuse me. This is another saline solution. Come on, plastic. And a heparin. So I get to do this every 8 hours. So I begin at 1:30 a.m. and then again at 9:30 a.m. and then again at 5:30 p.m. Yeah, so what we got going on here, up on my arm here, I got the sleeve, and right here I've got a PICC line. PICC-LINE, PICC line. So this is basically an intravenous catheter that runs 45 centimeters up through my arm, across my chest, and within a few inches of my heart. And because of this staph infection, I get to do this, like I said, every 8 hours. So I kind of got my routine down now. I actually learned how to do it in the hospital by watching them do it over and over. But then got a home nurse that comes once a week. She does my labs, my blood draw, changes the dressing on the PICC line here where it goes in my arm. Right now I'm just disinfecting the tips of these, even though they're sterile coming from the lab. Since I do have staph infection in my blood, I do not want to introduce anything else. And considering this this catheter IV line goes to my heart, so if I did something, I'd be pumping it straight into my heart and through my body. So trying not to take any chances. This green cap's pretty cool. This is actually filled with antibiotic. Keeps this clean, but of course, always want to double sterilize everything. Safety, safety. No guarantees. All right, so start with the saline solution. Oh, bleed the air out of there. Bubble, 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 and there we go. Push that baby in there. And this one, this is just a pump. This unlock my, okay, now it'll work. Just give a push stop, push stop, push stop. And what this does is it makes sure that this PICC line is cleaned out thoroughly. If there were any coagulation anywhere, if I just gave it a direct push, they say it could just slide on by. But if you give it a pump push, there's a better chance that if there is any coagulation, it's going to break it up and knock it out. So that's the first 10 milliliters saline solution. Now we go with the antibiotic. Bleed the air out of it. Bubble, bubble, bubble. That's good. Twist that baby on there. Now this is supposed to be a 3-minute push. And let me tell you, even with my timer, it's next to impossible for me to do that, just that little 10 milliliters and make it take 3 minutes. But 2 to 2.5 seems to be about my norm. Try and go as slow as I can. After pushing these other ones so much quicker, it's tough to make this take 3 minutes. But it's better to do a manual push than have to have a pump and set it up on a pump every day, 3 times a day. But anyway, this one's a refrigerated item. All the rest of these are room temperature. So this one comes out of the fridge 30 minutes to 60 minutes prior. And that's pretty much so that I just don't feel the cold shooting through around my arm, and I haven't felt it anywhere near my heart. So I'm thinking it must be warmed enough by the time it gets there that I don't notice that at all. But anyway, I was starting to tell you a story. I had this spinal cord stimulator implanted as a pain management device, and the 7-day trial worked great. So then I ended up getting the permanent one, and one of those, what do I want to say? One of those things that you never expect to happen, and it's such a rare occurrence. They have you sign the consent form before you have any surgical procedure, acknowledging that you know when your body is being cut into, being opened up, no matter how sterile the operating room is, no matter how sterile the tools are, no matter how sterile the doctors and nurses are, there's always a risk of getting an infection because your body's being opened. Come to find out afterwards from infectious disease, they said that 3 to 7% of surgical procedures end up returning with staph infection. Now there's 2 kinds of staph. The first one, and the one that I have, is called an MSSA. I don't remember exactly what the acronym stands for. I just know that the MSSA staph infection is the one that responds to the antibiotic medication. The other one, called MRSA, is resistant to any of the antibiotic medications. So that's really bad news bears if you get that one. So I guess I should consider myself lucky that I got the MSSA, which is treatable. So I get to do this for the next 6 weeks, three times a day, 1:30 a.m., 9:30 a.m., and 5:30 p.m. And it's supposed to clean out my blood. In addition to this IV, I also have another antibiotic oral medication. This one I take every 8 hours. So every time I do the infusion, I take one of these. And then there's another one that's another oral that I take twice a day. So I take that one with my morning meds and my nighttime meds for my pain management cocktail that I've been on for 3 years now. All right, so I'm hoping this is pushing 3 minutes here because it's almost to the end. So yep, I'm gonna go ahead and just push this, show you what's up. There, that's the end of that one. That one comes off. Now this one here, this is another saline. And what this does is it's a follow-up flush to make sure, again, that this 45 centimeter line to my heart is cleaned out. And it's also another pump push, so just a little push stop, push stop, push stop, push stop, push stop, all the way to the end. And this one can go much quicker. They actually didn't give me a time limit on it. When I was doing it the first time with the home nurse, I was going much slower, and she's like, go ahead, go ahead. Because I was thinking it was more like this one. But it is what it is. It doesn't matter if it's slow, it doesn't matter if it's fast, as long as it's a pump to, again, ensure that this entire line stays clean, does not get any coagulation, stays under positive pressure, because it's going to be full at all times. Getting to the end of this one. All right, so that one's done. And then lastly, you have this heparin. And this heparin is a blood thinner. I spent over a year on heparin and a couple months on Luvenox because I ended up with DVTs after I broke my back. But luckily that's all resolved itself. And this heparin is just another added insurance to make sure that this line stays clean and clear, with nothing backing up into it. If there was any blood to back up from my heart on back, this would dilute that blood, and that keeps it from coagulating and causing any blockage. Almost to the end of that one. Alright, now I stopped just short of the end. Now I'm going to pinch this off. Boom. See there? That clips the line right there. So now from here all the way to my heart is basically charged with this heparin solution, and then this extension tube so that I can reach it using two hands is also charged with positive pressure. Now this little blue cap on the end, this is a backflow preventer. I know we used to have oxygen bottles and gas bottles and things at work that had backflow preventers on it. And this is just the medical version of one. And then this cap that goes on the end, these are the special ones. There's different color caps for different things. This one in particular, green cap, is antibiotic, like I showed you on that one, how that's inside. That one's in the trash now. Peel this sticker off of there, that seal, and there we go. That goes on there just like that. And that's pretty much it. I found that. I'll take this and wrap it around my arm. Something about like that. Bring this back up. There we go. I had these from as a knee support because my knee's trashed from when I broke my back too. I trashed my body from my feet all the way up to my lumbar. I shattered a couple vertebrae. Lucky to be alive, but here I am. So Sticky Buds is still kicking it. Changing over to cannabis as my medicine, trying to get rid of a bunch of this other junk. Because of this new event, they say I will be on oral antibiotics the rest of my life. Won't have to do these intravenous, but I will be on oral because of the titanium that I have in my back. The infection could potentially have reached some of the metal, and if it touches it, it bonds with it, and then it'll be in my body forever. Now the MRI, the CAT scans, the x-rays, they all came back basically good. Even the echocardiogram showed that the bacteria did not attach itself to my heart valves, so I don't have to have a heart valve replacement. I'm thankful for that. But yeah, what a way to start 2020, huh? But so this is part of my new normal. Gotten to know a lot of you guys online, and just thought I'd share some of this with you, so you have an idea of what's going on. Hope everybody's having a good day. Strive for excellence, and just do all you can. Be grateful for the things that you can still do. I know a lot of you guys that I've talked to have your own issues and chronic pain, accidents, injuries. A lot of us have them and just have to deal with it. But for me, it's the new normal, and I'd be positive about it and just focus on the things that I can do. Gardening, taking up my indoor grow for cannabis has become such a blessing for me. It's like therapy. I could spend 2 hours, 3 hours a day down in my grow room, just hanging out with my plants and doing some training with them, defoliating, talking to them, moving things around. So yeah, that's been really cool. That cannabis not only is helping me in my pain management, but it's also helped me as a new hobby activity to fill my time, and it's very fulfilling, very, very therapeutic. So hope you guys enjoyed this, or get an understanding of what's going on. At least things do happen, so remember, if you ever have to go in for a surgery and your body's getting cut into, and they say that you need to sign this consent form, you never think this is going to happen to you, but guess what? It can. I was at one of the best medical facilities in the country, and I have top-notch doctors, the best doctors, but it happens. 3 to 7% chance. You get your body cut, you're exposing yourself, and they say staph infection is everywhere. It's on everybody's body, everything anybody touches. So again, no matter how sterile the room is, the equipment is, the tools are, the doctors and nurses are, it happens. And I drew the short straw. But I survived. It did not get into my spinal fluid and go to my brain, which when that happens, they say it causes spinal meningitis. And if it's not caught within 24 hours, once it's in your brain, you're done. You're gone. You're dead. You've moved on. Going home. So that didn't happen. It did not bind to my heart valves, so that's another great thing. Yay me. And just unfortunate way to meet the doctors, nurses, staff at the hospital, but they were all great. They are 100% top notch, and they're to help me in every way. So, again, hope you guys have a great day. Stay positive, stay motivated, strive for excellence, and life goes on. Sticky Buds out. Peace. Yay. Cheers.